Hey, good afternoon, Modexus. Happy Tuesday. The European Union just released some very exciting information on glutathione and its role in cardiovascular disease. So they did a meta-analysis of all the studies on glutathione and how it would impact cardiovascular disease. The very first thing that they mention is a reduction of inflammation. So glutathione being the master of inflammation, so reduction of inflammation. Inflammation in the cardiovascular system is where cardiovascular disease starts. The inflammation damages a molecule or a layer of tissue called the glycocalyx. The glycocalyx, once it's damaged, then inflammation can get right into the endothelium, your cardiovascular system. It causes plaque buildup. Plaque buildup, of course, can result in stroke, heart attack, and other difficult things. It also can cause the inflammation can cause a weakening in the ability of the heart to pump blood. And then there's also COPD and other things that are associated with inflammation in the cardiovascular system. So the very first thing they identified as a help in cardiovascular disease through glutathione optimization is the reduction of inflammation. The second thing they mentioned is the protection of telomeres. Now, telomeres, although not directly related to cardiovascular disease, they're related to overall health. Telomeres are the ends of our DNA, and those telomeres are like the end of a shoelace, so they're little packets of information tightly held. Like a shoelace has a piece of tape around it so you can thread it through a hole. The telomeres are like that on our DNA, and if it gets broken or splayed in a way, then the telomere sends misinformation to the DNA, and they can replicate as a cancer cell or just a plain mutated cell that has no purpose but causing inflammation in our body. So it will help protect the telomeres. The third is the amino acid that we have in Lonicera longevity called cysteine. Now, the reason we use cysteine is it uses the same transport mechanism as cysteine in our body, but cysteine gives us 2 molecules of cysteine instead of 1, so it's more efficient, more investment for our time and money. And cysteine as an individual model, not cysteine, cysteine as an individual molecule has been identified to have a direct impact on lipid lipolysis. So the reduction of fat or the breakdown of fat, the metabolism of fat directly in the liver. You might remember when we were talking about PROBIO balance, how if we have too much fat, it gets pushed back down into the intestinal tract or out into the bloodstream and raises LDL cholesterol. Well, cysteine has a direct impact, different than PROBIO balance, right in the liver in helping metabolize fat. So those are 3 ways in which they identified that optimizing glutathione can help in cardiovascular disease. I want to make a distinction, though, here very quickly. This study was done on amino acid therapy. So this was not done with liposomal glutathione. There's no evidence that liposomal glutathione has the same effect on cardiovascular disease. But you might remember that Lonicera longevity is dual form. We use a small amount of liposomal glutathione to trigger the molecule, the cells, to actually produce more glutathione, and they use the amino acids that are in the Lonicera longevity. So imagine now the synergy between Stericol, which has a direct impact on bile acids and the microbiome of your intestinal tract, and Lonicera longevity. So truly that package of Lonicera longevity and PROBIO balance is an amazing, amazing, and ever increasing, from a science point of view, proven way to help our body stay healthy. So hope you find this information useful, and we'll talk to you soon. Bye for now.